I began in the field of hair restoration about 20 years ago with my fellowship training, and this is what I've been doing full-time for a number of years. There have been very positive changes in the field in terms of the aesthetic appearance. My goal always is for patients to have a natural appearance, and I've been able to accomplish that with single follicular unit transplantation. The field has evolved in terms of extracting the hair follicles one by one in appropriate cases. The field of medical therapy and regenerative therapy to support your existing hair and potentially regrow some of the miniaturized hair has been burgeoning, and there are exciting new developments on the horizon. I'm a very strong advocate for the use of medical therapy to help support your existing hair. We do hair transplants every day. The best hair transplant in the world will look better when a patient can maintain what their existing hair is. The vast majority of my patients, I recommend medical therapy whether you have a hair transplant or not. Every patient has an opportunity to have customized medical therapy. In other words, we work with a compounding pharmacy to create just the right combination of topical product or oral product for each individual. There are other regenerative therapies that are very exciting. We've been using platelet-rich plasma for over a dozen years. I was one of the earlier adopters in the world of hair loss. So platelet-rich plasma involves using your own growth factors to stimulate growth of your hair. And one of the things we've introduced recently are exosomes. Exosomes are extracellular vesicles, tiny growth factors that can be injected into the scalp under local anesthesia that stimulate the growth of your own hair cells to promote more robust growth.